Ania Wisniak. I'm a public health doctor and I've been working on cervical cancer prevention in Cameroon for the past 6 years. Why this topic? Well, cervical cancer is the second most frequent cancer among women in Cameroon and the most deadly. The good news? It's almost entirely preventable by vaccination against a virus called HPV and by screening of early precancerous lesions. Since 2015, a cervical cancer screening program has been running in the West region of Cameroon in collaboration between local health authorities, health facilities, and the Geneva University hospitals. But this experience has revealed a big gap. Urban women are getting screened more than women in rural areas, despite efforts to communicate about the screening program in these rural settings. This gave me the idea to explore community-based participatory action research. Instead of outsiders deciding what's best, I'm working directly with affected communities to co-create solutions that work for them and to improve access to screening in an equitable way. Here's how it works. Before anything else, the key is to listen to the community. In our study, we conducted interviews and focus group discussions with key community members in the health district of Mifi in West Cameroon. Who were they? Of course, women eligible for screening, but also older women, men, community health workers, local healthcare providers, and even local leaders, religious, traditional, and district health officers. The objective was to understand what helps and what prevents women from getting screened. Next, we co-created solutions. In 7 rural health areas, people were brought together in workshops to design screening strategies that fit their specific needs, whether that was the place of screening, for example, at local clinics or at home, or how to conduct awareness campaigns. Then, we put those strategies to the test. These new community-driven approaches are being compared over 1 year with traditional hospital-based screening taking place in 7 other rural health areas. At the end, we will see which works better at increasing screening rates. Finally, we will assess what worked and what didn't. We'll gather feedback to ensure the most effective strategies can be used in more communities across Cameroon, and maybe even beyond. The goal? Equitable access to screening, higher screening rates, and ultimately preventing unnecessary suffering and death. By involving communities in the solution, we're taking a big step toward eliminating cervical cancer as a public health problem. Every woman deserves a chance to prevent cervical cancer. With community-driven action, we can make that happen.